Welcome, my name is Peter Strong. I'm a professional psychotherapist and I offer online therapy for anxiety, depression, PTSD and also addictions. Many people like the idea of online treatment for addiction via Skype because it's more private for you. It means that you can have your sessions from home, you don't have to travel to a therapist's office, and you can work in a more private and intimate way on your addiction. The other reason that people like online therapy for work with their addiction is because often people feel a lot of shame and guilt around addiction. And it's, again, difficult to get the motivation to go and see a therapist or counselor in their office. The approach that I use for treating addiction is based on helping you change the underlying psychological, emotional habits that cause your addiction. Mostly I work with addiction to alcohol, but there are many other forms of addiction. The one thing they all have in common is they're based on an underlying emotional reactivity, some form of unresolved, painful emotion that is not healing, basically, and that fuels the addictive process, usually as a way of escaping that emotional pain. So during the online sessions, I will be teaching you how to apply mindfulness specifically for working with these unresolved emotions to help you bring their resolution, to heal those emotions. And we do this at two levels, one of which is we learn to work with the emotional reactivity in the form of those addictive impulses, those compulsive impulses themselves. So we have to learn how to manage those, because if you don't, if you become a slave to those emotional impulses to drink or overeat or whatever it might be, then that behavioral reactivity will reinforce that underlying core emotion that's causing the addiction in the first place. So we have to learn to manage the impulses. And the second thing we do is work on the underlying core emotion, the depression, the shame, the guilt, the stress, whatever it might be, the emotional trauma, whatever it might be that's fueling the addiction. So we do this by learning to meditate on our mind. We learn to meditate on those emotional reactions, the two types, the core emotion, of course, but also the impulses, the addictive impulses. We deliberately bring those into the mind so that we can begin to change our relationship to them, so that we break this habit of becoming a slave to those emotional habitual reactions. This is the most important thing that will promote healing. If you stop feeding the reactivity, then you allow those emotions to continue their process of healing. So there are a variety of techniques we use, but the most important one is meditation on your emotions. We do not meditate to escape our emotions, which is often taught, but is something that I fundamentally disagree with. We meditate on our emotional pain itself in order to facilitate healing. That is what needs our attention. So we begin to see that emotional pain very much in the same way that we might see a child in pain. We don't avoid the child's pain. We go and take care of it. We learn how to establish a conscious and friendly relationship with that child, because that is what will promote its healing. And we must do the same thing with our own emotions. And that is the focus of the mindfulness approach. There are lots of other details in this approach that explain why the mindfulness approach to working with emotions and working with addiction is so effective. I will teach you these during each of our sessions. The main factor that you need to have is motivation. You need to be committed to changing and healing this underlying emotional reactivity. If you are committed, then you will see substantial improvements. You will be able to break the habit of your addiction. It may take several sessions to do this, but that is a function of how committed you are, how well you understand how to apply mindfulness and meditation to work on your addiction and the underlying emotions, and how much you practice. So if this is something that you're interested in pursuing, and you feel ready for this work, then I invite you to email me, contact me, and let's schedule a session so you can see for yourself if this approach is going to work for you. It certainly has helped a great number of people over the last 10 or so years that I've been offering online mindfulness therapy for the treatment of anxiety, depression, and also for the treatment of addictions. So please reach out to me, ask any questions you may have, and let's get started. Thank you.